Hello everybody. So today we'll be talking about preterm, term and postterm baby. They are classified based on the gestational age. So a gestational age of 37 weeks to 41 weeks plus 6 days, if any baby born between this gestational age, that is what is a term baby. So any baby born before that, before 37 weeks, that is a preterm baby. And postterm baby means a baby born after 42 weeks of gestation. This gestational age is calculated from the last menstrual period, LMP, the first day of last menstrual period. So first we will be differentiating between the preterm and term babies. So term babies having a good muscle tone, always maintaining an attitude of universal flexion, where in case of preterm baby, because there is less muscle tone, there will be extension posture. Number two is scarf sign. What is scarf sign? It is a newborn assessment finding in which the infant's elbow crosses the midline towards the opposite shoulder when the examiner draws the arm. So, in case of preterm, as there is less muscle tone or less tone, so without any resistance, the elbow crosses the midline. So, that is what is curve sign positive. Obviously, in case of term, you will feel resistance when the examiner draws the elbow towards opposite side. There will be resistance. So, that's why scarf sign is negative. Number two, about external genitalia. In case of male, term babies will be having rugosity in the scrotum along with hyperpigmentation. And also, if you palpate the scrotum, you will find the testicle inside. In preterm, the scrotum appears light colored and also lightweight, so there is lack of hyperpigmentation and also absent rugosities, and testis is undescended, so you cannot palpate it also. In case of female or the girls here, so the external genitalia here, we know ki labia majora covers the labia minora, and in term babies you can only appreciate labia majora from outside. But in case of preterm, the labia minora are also visible. Number 5 is the breast buds or breast nodules, which is less than 5 millimeter in preterm and more than 5 millimeter in case of term babies. Number 5 that you need to remember here is ear recoil. So when you press the elastic cartilage of the ear, then what happens, because there is well developed elastic cartilage in term babies, so there will be faster recoil than a preterm baby because the elastic cartilage is not properly developed there. And lastly, you have lanugo hair. The lanugo hairs are basically the fetal hair. Okay, so preterm baby, they are having abundance of this layer. Term babies will be having a sparse or absent lanugo hair. Coming to the post-term baby who are born after 42 weeks of gestation, so in that case, because they are growing beyond the gestation, so there will be wrinkling of the skin because of the overgrowth. There will be overgrown fingernail also, and meconium staining over the nails, fingers and body. Why there is meconium staining? Because after 42 weeks, the anal sphincter opens. So there will be intrauterine passage of meconium into the amniotic fluid. Another thing also, because after 42 weeks what happens, the motilin hormone is actually present, and that causes peristalsis of the fetal gut. So that causes meconium staining of the liquor, and ultimately there may be meconium aspiration syndrome also. So this overall concludes the preterm, term and postterm babies.